I'm Dr. Haley Todsen, a board-certified emergency physician practicing for 20 years, a Menopause Society certified practitioner, and the founder of Optimize Integrative Health.
My name is Bailey. I am the family nurse practitioner here at Optimize Integrative. I have 7 years of experience in the medical field. I am functionally certified, and I love focusing on longevity within this practice, and we hope you enjoy this podcast. So today we're going to talk about improving body composition and 3 factors that can contribute to your body composition. And they are protein, strength training / muscle mass, and what your insulin level is, and whether you are insulin sensitive or insulin resistant. So when we are talking about body composition, we're talking about what the percentage of your body weight is fat, what percentage of your body weight is muscle, what percentage is bones, etc. And your weight doesn't necessarily matter, as we've seen come through in the years. And muscle obviously weighs more than fat. So again, that circles back to your body composition being comprised of the amount of muscle you have and how much strength training you do. And adjusting or working on your body composition isn't always about weight loss. I've worked with people in the past where they stay the same weight, but some of the changes they make, they lose fat and gain muscle at the same time. So those are the 3 factors we'll be going over that contribute to body composition today.
Right. So like you said, body composition is not just what you weigh on that scale. We use our Staiku 3D body composition measurement to really look at the lean mass versus fat mass. When we talk about the fat mass, we're talking about the subcutaneous, the visceral fat, and really trying to decrease that while increasing the lean mass. So when someone comes to us and says, I want to lose weight, what they're really saying is, I want to build muscle and lose that fat mass, which is so important to be able to measure that as we move patients through our program.
Absolutely. So now that we've covered a little bit and touched on body composition, we'll start with number 1, which is protein, which contributes to your body composition. And protein helps with muscle retention, muscle building. It also helps with satiety, your muscle recovery, the stability of your blood sugar, and a healthy metabolism. So when someone does set out either on a weight, you can lose weight while adjusting your body composition. But if you want to target more fat loss and preserve your muscle mass and maybe even put on muscle mass, protein is key here to preserve that muscle when someone is in a fat loss phase. And again, with the protein increasing satiety, there are studies that have been done where people are in a fat loss phase, and the people who are eating higher amounts of protein have more satiety while they are going through a dieting phase. And protein also has a higher thermic effect than carbohydrates and fats. So when you consume protein, your body has to expend more energy to digest it versus if you were to consume carbohydrates or fat. Many women are under eating protein, and this is a huge mistake that women make when they go into a fat loss phase or try to go into fat loss phase or even go on a peptide to try to lose fat. If they're not eating enough protein, their body composition will change, but not for the better. They'll lose muscle, maybe lose some fat, but then there's nothing under that fat to show when you're putting in all that work. And if your protein is too low, you may not see any body composition changes. So when I work with patients and take an analysis of their dietary intake and they're not eating enough protein, sometimes making that small adjustment of increasing the protein will make a huge change to the body composition. So again, you cannot build, maintain, or recover well if you're not eating enough protein. So always make the protein the priority of your meal. And always start the day with a high protein breakfast if you're able, and those will make huge changes. And you don't have to be perfect, just be consistent. I tell some of my patients, start with 30 grams of protein 3 times a day. You get at least 90, and then you can increase from there. So that's the bare minimum I have my patients do if they're not doing that much already, and then we go up from there. You don't have to be perfect, but making small changes will add up over time.
I love it. And then lever 2 is going to be the strength training part. So we know that strength training tells the body to keep and build muscle. The CDC actually reports that 1 in 10 cases of premature death can be prevented by just strength training. It also can lower the risk of diabetes, breast cancer, and heart disease, obviously. So the benefits also for even children is it can decrease depression. Obviously, it can help with body composition and increasing the lean mass. It can help with insulin sensitivity and prediabetes. Obviously, in adults, it can do the same thing. It can lower your blood pressure. Yeah. It can help with your insulin sensitivity. It obviously helps building with the muscle mass, which is metabolically active. So there's so many benefits to strength training. It helps protect the bones so that we do not develop osteoporosis. So when we lose weight, we need to increase our muscle mass to protect our bones. And that's one of the big things. We know that through menopause and perimenopause, we start losing 3 to 8% of our muscle mass per decade. And it increases with the age. And so that's why it's important to really work out and increase the muscle mass, because if not, you are going to lose it and to keep using it. The other part about strength training is just start. If you're working out right now and you're just doing cardiovascular works and taking walks, that's wonderful. If you're getting into zone 2, we talk about zone 2 all the time, that's really good for heart health. But really, to build the muscle, you have to do strength training with progressive overload. You need to do at least 2 to 4 a week. So if you're right now not doing any, start with 2 strength training days a week. Start somewhere. If you're doing 2, work up to 4 and really try to build that muscle for preventative health.
Yeah, absolutely. And that's something I do with my patients. If they come into me and they have never worked out in their life, we start very small, and I say number one thing you need to start doing right now is strength training. Minimum 2 per week. We'll add everything else in later, but the data and the benefits backing having more muscle mass and working your muscles is astounding, and that is a non-negotiable for adding in for my patient plans. So now we'll talk about insulin, which eating the protein and strength training can affect the insulin as well. But if you don't know if you're insulin resistant or insulin sensitive, it could explain why maybe you're not able to lose a lot of fat, and then making small tweaks for that. So if you think insulin is a hormone, it's produced by the pancreas, and the purpose of insulin is to store. It also brings glucose into the cells to be used for energy. And insulin is not the enemy. We need it to survive. You would die without it. But when it becomes dysregulated or too high, meaning that your body's glucose levels have been sustained too high, that your insulin has to come up to match it, that becomes an issue. And then you have women coming in who are insulin resistant, which is having a high insulin level where they can't lose fat. So how do we combat insulin resistance or high insulin levels so that we can help with body composition? And I talked about this previously, but eating your protein first in every meal. You should always be eating your protein and your fat first. And if you can wait a few minutes between eating your protein or carb, not everybody can, then that is even more optimal, because you're giving your body the chance to start digesting the protein. and the fat, and it will allocate a lot of energy to that. And then eating the carb shortly after will lower the glycemic index of that carbohydrate. Also helping with insulin resistance is time restricted eating. So you could start with a 12-12 eating window, meaning that for 12 hours a day, you can eat your food, 7 a.m. to 7 p.m. This is a plan I put some of my patients on who have never intermittent fasted or done time restricted eating. And then they'll go 7 p.m. to 7 a.m., no food. And then we start shortening that window every couple weeks. And just from the body not getting food in 12 hours, 14 hours, 16 hours will make a huge difference on the insulin and glucose balance. And another thing you can do that I did not discuss is walking after meals. If you can do either 10 body weight squats or a 5 to 10 minute walk after meals, that can help with the insulin and glucose balance in the body. So yeah, how do these all work together?
Yeah. So all of these levers work together in our body. The protein feeds the muscle, the strength training builds the muscle, and then the muscle helps with the insulin resistance and the insulin sensitivity. And then once our body can use all of this, our hunger gets better, our energy gets better, our recovery gets better. And all of this works together then to help with the fat loss that we need and the lean muscle gain. So we don't treat one in isolation. Treating all of this together is really going to make a difference. So if you are working out more, eating less, but not seeing that body composition change that you want to with the increase in lean muscle mass and decrease in fat mass, give us a call to work with us for a personalized plan to get you healthier. This podcast and all related content are provided for educational and informational purposes only. Nothing discussed on this show is intended to be, nor should it be interpreted as, medical advice, diagnosis, or treatment. No doctor-patient or provider-patient relationship is created by listening to this podcast, watching this video, or engaging with any of our content. Although I am a licensed physician and Bailey is a licensed nurse practitioner, we are not acting as your personal healthcare providers in this setting. The information presented is general in nature and may not apply to your individual medical situation. You should not rely on anything discussed here as a substitute for professional medical care, diagnosis, or treatment. Always consult your own physician or qualified healthcare provider regarding any medical condition, medication, supplement, or health decision. Never disregard or delay seeking professional medical advice because of something you heard on this podcast. Optimize Integrative Health, its clinicians, and its affiliates expressly disclaim any and all liability for actions taken or not taken based on the information provided in this program.